am Dr. Marilyn Griffin. I am a pediatrician, a child, adolescent, and adult psychiatrist, and currently an assistant professor of clinical psychiatry at the University of Illinois College of Medicine, where I wear several hats. I am the medical director of the Comprehensive ADHD Clinic, a consultant for the Illinois Doc Assist program, and the faculty career advisor for the College of Medicine's Urban Health program. What does it mean to be a Black female physician? It means that I am visible. It means that I am present at the table and that I can have an influence not only on the patients and the families that I treat, but also other aspiring African Americans who desire to be a physician. When I was 12 and I first declared that I wanted to be a pediatrician, I didn't know any physicians and I didn't have any role models to look up to. A word that describes my journey to medicine. If you look in a dictionary next to the word persistence, my name and my picture will be there. I applied to medical school 3 times before I was successful in obtaining admission. And my admission came with conditions. I was actually accepted into the College of Medicine's Urban Health program's post-baccalaureate program. And that I spent a year during that program, and I had to maintain a 3.0 GPA in order to become admitted to the following year's M1 class. After completing the post-bac program, I was told that I needed to decompress my first year of medical school. And at the time, this was an option to split the first year of the medical curriculum into 2 years. I was initially pretty sad and a little upset about that decision and stipulation with my acceptance, but it turned out to be a wonderful thing and actually helped me to obtain opportunities that I probably never would have been afforded if I had gone through the traditional way and not decompressed. And that included becoming an anatomy TA and being able to hone my skills within anatomy and the anatomy lab, and also my teaching skills were fully developed at that level. Some other challenges and successes during my journey included a USMLE Step 1 failure. After I opened the letter and saw that I did not successfully pass Step 1, I was done. I decided that I was going to quit medicine. I remember sitting in my Dean for Student Affairs office and telling her that I quit and that I was going to be a hospital greeter because I like to smile and I was good with people and directions. She laughed at me and told me to go home, spend some time with my family, and then come back prepared to study and take another attempt at the exam. And I successfully passed during my second attempt. Because of my failure, I was what they called out of phase in the rest of the medical curriculum. And so this set me back a little bit more, and I was not able to graduate with my initial incoming class. Everything happens for a reason, and there can also be blessings in situations that you think are dire or disastrous. So not graduating with my incoming class afforded me some other opportunities to succeed and to be recipients of scholarships and awards. During my 4th year of medical school, I was able to study abroad for a month in Scotland at the University of Edinburgh. And I had a phenomenal time and a great experience learning about medicine and how they do things in Scotland. The team that I worked with was very helpful and wanted me to explore their country. And so they gave me a lot of flexibility when I wasn't providing clinical care or doing autopsies with my clinical preceptor, then I had some time to explore the country. 4th year of medical school is the time where you decide what's going to be the next step and what residency you will pursue. As I mentioned, at 12, I declared that I wanted to be a doctor and a pediatrician. However, during my third year, my first rotation was inpatient psychiatry, and I absolutely fell in love. And so I had to figure out which residency I would pursue. I was introduced to a program called Triple Board, which is a 5-year residency training combining general pediatrics, adult psychiatry, and child and adolescent psychiatry training. At the time, and it probably still is, a pretty competitive specialty to get into because there are only 10 programs in the country. At least at the time that I was applying, there were 10 active programs in the country, and each program takes 2 to 3 residents a year. So I've already told you about my history and my journey to medicine. So when I talked with some of my advisors about wanting to pursue this triple board residency program, I was told and advised that I should have what we call then a backup plan. We've changed our terminology within medical education not to talk about backup plans, but parallel plans now. And at the time, I thought, why would I have a backup plan? This is what I want to do, and so I'm going to pursue it with full force. And because I had decompressed and because I had failed step 1 and I was out of phase, I had more time to pursue elective rotations at other institutions outside of mine because we did not have a triple board program. And I did a rotation at the University of Pittsburgh Medical Center as well as Indiana University in Indianapolis. Both of those institutions have triple board programs. And I was able to get more information about it, talk with current residents, speak with program directors, and also it was an opportunity for me to shine and show them what I could contribute to their programs and to the field. Needless to say, I did not follow the advice and have a backup plan, and I only applied to triple board programs. Remember, there were 10 in the country that were accepting applicants. I applied to 8. 2 of the programs were in places that I don't think would have been a good fit for me, so I didn't even bother to apply. So I applied to 8. I interviewed at 6, and I ranked 4. Pretty gutsy for an African American girl from the south side of Chicago, but I did it. And I matched in my top program, which was the University of Pittsburgh Medical Center. And I successfully completed the 5-year triple board training, and I'm here today to talk about it. So, advice to current medical students, residents, aspiring medical students: never give up on your dream. If medicine is something that you feel that you are supposed to do, then it will happen for you. You have to have faith in yourself, and you have to surround yourselves with individuals that also believe in you, that can mentor you, support you, promote and sponsor you, and most importantly, believe in you when you don't even believe in yourself. It is possible, it's attainable. I am here, and I am a success story, and I am an extension of you. And just something else to keep in mind, that even though you are in medical school, in residency training, life doesn't stop for you. Life continues to happen, and there will be things that you will have to manage and learn how to deal with. For me, it was death, dying, and grief. So my maternal grandmother, we were celebrating her birthday one Saturday. The following Saturday, she died. The Saturday after that, we buried her. And then that following Monday was orientation for first year of medical school. And I had to leave my family and try to manage and deal with my emotions and feelings regarding her death, but also starting this new venture. First time being away from home other than a 45-minute drive for when I went away to college. And so this was a very difficult time and transition. And then my last year of medical school, my father died. And that was another difficult time. But my family and friends were there and supportive of me. And you never really have time to grieve because things don't stop. Just as life doesn't stop for medicine, medicine doesn't really stop for life. And you're expected to continue and keep going. But I, again, was surrounded by a great group of people within the College of Medicine and my friends that were very instrumental in getting me through those 2 periods of time. So I equated the beginning of my medical education, the end of medical school, with death. And then, of course, going into residency, it just continued on. And I had to, again, kind of manage and go through the death of other family members during that training. So back to my advice, it's very important to surround yourself with positive individuals, people that can pray for you, send good vibes into the world for you, and just surround you with love, encouragement, and support. It is vital to your success in medicine.